Through your employer's partnership with OELS, you have access to a number of benefits that normally are only available to much larger employers. Today we'll go through this as this is our open enrollment period for the 2019 calendar year. As you can see on this page, the agenda will follow is here, open enrollment. That's this time of year when you get to make options to participate or not participate, or to make changes in how you participate in the employee benefits programs. We'll go through medical for the most part, but then we'll also talk about new programs which are available through dental, vision, and voluntary benefit programs offered through MetLife. We'll then close with some dates that we need to be aware of to make sure that you have the important information you need to make your employee benefit decisions. Open enrollment applies for the most part to active full-time employees working 30 more hours per week. There will be some options later that we'll talk about for benefits that are available for those working 20 more hours per week. We have 5 medical options, 2 dental options, enabling you to customize a program that fits your needs. If you have any questions, you can always talk to HR professionals at OELS regarding the options, what your information is today, to make sure that you have confirmation of the correct beneficiary designations, as well as the programs that you thought you had enrolled in. As you'll see on this grid here, the benefits are offered through Excelis, Blue Cross Blue Shield, and MetLife. Starting with the medical, there's a number of terms that we'll go through. On this page, you can see the 4 major areas that make up how you pay for benefits when you go to the doctor or go into a healthcare facility. It could be a copayment, which is a fixed dollar amount, and that's available through a few of the benefit offerings we have. Most have a deductible, and that's an upfront cost that you pay before the insurance company shares costs. When the insurance company starts sharing the costs with you, that's called coinsurance, and we'll show how that works in the 5 different plans. And all 3 of these roll up to what's known as the out-of-pocket maximum. That is, in a given calendar year, the maximum amount of out-of-pocket expense that you could have in the health plan. Please note that out-of-network costs can be in addition to all of these, and that's something that we'll talk about, making sure that you're aware of what is an in-network and out-of-network provider. With 5 plans, many people ask, how do I choose which one is best for me? There is no right answer. It really depends on a couple of things, and we've put 3 different considerations up on this screen. First of all, if you have a preference for copays, and that is you want to know exactly what the cost of seeking healthcare is, that might weigh in as one of the decision points. If you're not afraid of deductibles and you want to pay less for your healthcare insurance through your paychecks, then maybe copays are something that are not that important to you. You need to know, though, what types of medications, how frequently you use those, and how frequently you go to the doctor's offices to know whether copays or other ways of paying for your health insurance is going to best fit with your needs and preferences. There's a lot of options for healthcare, and one thing that we'll talk about are some tools that help you find out what the cost is from one provider to another. And most people don't understand that there is actually different charges among Blue Cross Blue Shield providers, even though they both are in-network providers. Also, most people know that generic drugs are usually the most affordable, but when those aren't available, what are some options that you have, and what are some things that the insurance company might ask of you? So we'll go through that a little bit. And did you know also that depending on the pharmacy you go to, much like the provider or doctor, you could pay more for a specific drug at one outlet versus another. And then lastly, do you know your healthcare history? Meaning, how much do you use healthcare? How often do you go to the doctor? What types of doctors do you go to? What prescription drugs do you use? If you know that, you can really look through how each plan would cover those different services that you've had over the last year or two, and that information is available on the Excelis site to pick what plan might be best for you. We'll show you how to use the Excelis site to actually look back on your historical usage if you've been on the health plan for a number of years. This grid shows the in-network benefits for each of the 5 options. You can see that the copay option is the first one, and I had said that copays do exist in some of the plans that we have. The first two plans specifically have copays for doctor's visits. Now, it's important to note that regardless which of the 5 plans you pick, all 5 actually cover the same services. There is no difference in what is covered under one versus what's covered in another. What does vary is how much you pay for those services. It's also important to note that regardless of which of the 5 you pick, your preventive care is always going to be covered in full with no out-of-pocket cost. So as we look at these 5, you'll note at the bottom of the page that the number of dollar signs represents the premium cost. Now, what you pay for the premiums will vary depending on whether or not your employer subsidizes those in some ways, but this is the starting premium, and you can see that the copay on the left side of this table is the most expensive plan, and then as we go to the right side, you'll see that gets to the lesser expensive plans. The copays in the copay plan really apply to everything. So by that I mean there is no deductible. When you go to a doctor for a non-preventive service, you'll pay $30 or $50 depending on whether they're a general physician, or a specialty physician. If you went into the hospital, you would pay a one-time copay of $250. If you went outpatient for a surgical episode, you'd pay a $150 copay. And then you can see ERs, urgent care, lab, and x-ray are all covered by a flat copay. And then lastly, prescription drugs, they too are covered by a flat copay depending on if they're generic for $10, preferred brand for $30, or non-preferred brand for $50. Where the drugs that you may be prescribed fall into these 3 categories is on something called a formulary that is available on the Blue Cross Blue Shield website. And many of the plans have $0 generic drugs available for children under the age of 19. As we move down, you'll see that copays start to go away and deductibles become more prevalent. The next plan is a hybrid plan, which is a blend of a deductible plan and a copay plan. So you'll see that you do have a deductible, but for non-preventive services, again, preventive care is always covered in full. For non-preventive, if you go into a hospital or have an outpatient surgery, you may have a deductible apply first. But if you go to the physician for an office visit, that $30 or $50 copay will apply first without having to pay the deductible. And you'll see that there is deductible and coinsurance, or D&C, shown for inpatient hospital and outpatient surgery. That means that once you meet the deductible, $1,000 per person in your family up to a max of 3, then you would start paying 20% coinsurance that you can see in the bottom the third gray line that says 20%. You pay 20% of the cost until that deductible that you've paid and your 20% adds up to a $4,200 maximum. So again, you could pay $3,200 more than the deductible, which is your 20%, 20%, 20%. So it would actually take a significant amount of money to hit that $4,200. It would take the $1,000 deductible, and then you'd actually have 20% of the next $17,000 or $16,000. And again, the out-of-pocket could be 3 per family, so a maximum of $12,600. The next 3 plans are high deductible plans, which means that there's always going to be a deductible and not copays that hit you first. Again, all preventive care covered in full, but then it's going to be dependent upon which plan you choose, whether your deductible is $2,600, $5,500, or as you can see, the last one, $6,350. These work a little bit differently than the hybrid plan in that there's either a single deductible or family. So you could be you and your spouse and child, you and your spouse and 5 children, but you will either be responsible for the single deductible as a single participant, or you all go towards the family deductible. So that's important to know. In the 2600 plan, you still have coinsurance, meaning that once you meet that deductible for yourself on a $2,600 basis, or if you have more than yourself covered, a $5,200 basis, Then you'll pay 20% until you hit the out-of-pocket maximum you see at the bottom of $5,500 or $11,000. In the other two plans, you actually only meet the deductible, and then you go on and everything's covered in full, but they are significantly higher deductibles. So you can see that the 5,500 plan has the same out-of-pocket maximum, but that's all made up of deductible, meaning you have to pay that full amount as it comes in. There's no cost share from the insurance company until they start paying once you meet that deductible. And similarly for the 6350 plan. So we'll go into showing you the rates here. And again, this whole PowerPoint, as well as more detailed information, is available through the HR resources at OELS. If you have any questions, certainly reach out to them. But you can see this table is set up the same with the rates, except it shows going from top to bottom the employee, employee and spouse, employee and children, or family coverage costs on a monthly, biweekly, and weekly basis. There is flexible spending accounts available, and those flexible spending accounts are administered by Task, which is a partner of OELS. And again, you can put money into the flexible spending account to use towards your copays or your deductible or any of your out-of-pocket expenses. And you can put money away, which will be taken out per paycheck throughout the year, up to $2,700. Again, those dollars are going to be available up front all at once on January 1st. So this can be a great way to help you budget for your healthcare expenses. But do know that even though you can save on taxes, if you don't use the amounts, some of those could actually be lost. So you can roll over up to $500 that you didn't use in a particular calendar year. But if you elected, say, $2,000 and you still had $1,000 left at the end of the year, you'd only be able to roll over $500, meaning you'd forfeit the other $500. And again, that's not a decision of your employer or OELS. That's the way the federal government sets these up. And that's one of the rules so that you can have tax savings, is that there has to be some type of risk at the end. If you don't use it, that some of that could be lost. You can also participate for dependent care flexible spending account, and that is up to $5,000 a year for qualified individuals who are working and have their children in a qualified healthcare program. A health savings account is available for people who participate in 3 of the 5 plans that are offered through OELS. And by that, I mean either the 2,600, the 5,500, or the highest high deductible plan. So if you participate in those, you're in a qualified high deductible health plan, which means that you can open up a health savings account. And this is one of the better options out there because you can use the health savings account dollars for medical, dental, vision. You can also use it for COBRA premiums if you were in between jobs and wanted to continue the health plan offered through OELS. But you don't have to use the money by year end. So you get all of the benefits of a flexible spending account without the use it or lose it rule impacting you in any way. So many people call this like a 401k healthcare plan. So you can use this long term. The money you put in there just continues to sit in that account, and the account is always in your name. So you actually have use of the account even if you change employers, even if you are someday not in a qualified high deductible health plan, say you're on Medicare, you can pull money out of this account at that time in your 60s to actually offset out-of-pocket costs that you have for healthcare. And as long as you use that for healthcare expenses, you never have to pay taxes on that, which is one of the only accounts that exists in the U.S. tax system. You can say that about, that you'll never pay taxes on money that you put into these accounts. So they go in tax-free, they can grow or even be invested, and those gains can grow tax-free, and you can take it out to pay for an expense, and you never pay taxes on that distribution either. So you can do this with any bank, as long as they are qualified to administer a health savings account plan. So you can ask your current bank if they have an HSA custodian account. If they don't, you can have this done through OELS. through a company called Task, which is the same one I mentioned for the Flexible Spending Account Administration. They do, however, charge a $3 per month account fee, which maybe at your credit union or bank, they may be able to offer it to you with no account fees. So again, you just need to fill out an HSA enrollment form and you can participate. The money will come out during your payroll cycle. So it comes out pre-tax out of each check that you say. You can raise and lower that as you see fit just by telling payroll. And you can see the limits, again, are up. Those are subject to change with the U.S. government. And this year they went up $50 for a single, so that it's $3,500 max for those that have single coverage. If you have other than single coverage, you're going to have family contribution limits of $7,000. And if you're over age 55, you do have the opportunity to put in $1,000 above those two limits if you care to. Any questions on this? Certainly reach out to us. There's a number of ways to save your healthcare dollars. So again, by using these pre-tax plans like FSA or health savings account, but also by just knowing some tools that are available to make sure that you're not overspending. So one in the pharmacy area, besides using generic drugs, is to use a program called goodrx.com, which is a website that I'll go over in a minute that gives you some great information on how to find the cheapest alternative for the prescriptions that you're on. Also in and out of network providers. So again, just to reinforce, Blue Cross Blue Shield gets over a 50% discount for their in-network providers. So going out of network would mean that you effectively could pay double when you are seeking coverage. And again, you also could be balance billed for some amounts that could be a surprise, and that's where you hear some horror stories. So stay away from out-of-network providers to the extent that you can. And lastly, emergency rooms certainly have their use. Many people get into bad habits of using them as their primary care physician, and we want to make sure that you understand the costs of an emergency room can be dramatic, especially if you're on a high deductible health plan. Those costs can be upwards of $1,500 or $2,000 versus an urgent care facility, which could be $250 or less. So just be aware of that, and we'll also talk about another opportunity that you have to save money when you have an urgent situation. The GoodRx website that we had talked about is shown here, and again, you don't have to give any of your personal information. You can simply log into this and put in a zip code, a specific drug that you're actually have been prescribed and are going to obtain from the pharmacy. And what you'll see is that it will give you a listing of all the pharmacies in your area and what the charge would be at each of those. And you will see that there will be variances. The other thing that's great about this site is it does give you easy access to coupons, or if there's financial assistance that's available on a specific name brand drug. You don't have to search the internet for that information. It's all consolidated on this GoodRx website. Telemedicine through MD Live is also a new feature that came online last year for the benefit programs. This program is actually embedded in all the Blue Cross Blue Shield coverages, and it's an alternative to either an emergency room visit or a urgent care visit. You can see that it's very simple to use, either by a toll-free call, or you can do in a Skype-like video conference with a doctor, or you can do it from your PC or smartphone. So you have multiple options to access this, but this is great if you're traveling or if you have a child maybe that's out of town at camp or at college. And this is something that gives them immediate access to a consult with a physician in a time when they might not know what they should do next. So it's very inexpensive. It's going to be a discount off of either your PPO copays, or the high deductible health plan members would see a much lower cost than they'd pay for even going to a doctor's visit. So you can see it's $10 on the copay plan or $40 on the high deductible health plan. You do want to set this up before you need to use it, because you will be paying with a credit card or with your health savings account card or some other means. But you do have to set that up. It does take time. And once you have it set up, from the time you reach out to the service to the time they respond to you is less than 10 minutes. But if you're sitting there having to access, your credit card and your insurance card information to log in, it's going to take much longer. It's available 24 hours a day, every day of the year, and it's available in all states except for Arkansas currently. Also, we'll be adding behavioral health in the first quarter of this year, which again is another great service for some people, who might not be comfortable going to see a behavioral health specialist live. And you can see that that's coming online. They say 1/1/19, but it might be a little after that, but definitely in the first quarter. I mentioned how to get information on the Excelis website, and these are the quick 5 steps that you need to take to actually create your username and password. Very simple. Just go into excelisbcbs.com, clicking on member, logging in, and then using the register now button. You'll just need to have your Excelis insurance card, which has your account ID and your number, and then you'll be off to the races as far as being able to look up your personal information. You can see how much you spend. You can see where you are to your current deductible for the year to see if you've come close to meeting it yet. You can see any of the transactions that you've had to make sure that Excelis has discounted the cost before you pay your provider. But more importantly, there's a nice new addition that's at the bottom half of that sheet, which I'm showing you here. On the lower right-hand side, you can see something called the treatment cost calculator. And this is one of the first times you've been able to actually look up and see what it would cost to have a service done at one doctor versus another in our area. So again, when you actually click on that, you could put in some very specific information, just like on GoodRx. So you could put your zip code that you wanted to have the service done. You could put what the service was, or you could do a specific physician, and it will show you, based on distance and based on cost, all of your options in the area. So you can see that an X-ray or an MRI or a shoulder surgery could vary by hundreds of dollars from one provider to another. But more importantly, you can see how many times that provider has actually done the service. So you can see if someone is going to do work on your knee or your hip, have they done it 20 times this year or 200 times this year? So that's some important and nice information that I think you'll find value in. And that's, again, available to everyone who has set up a username and password on the Excelis site. Again, very quick to do that. We'll now jump into some of the MET programs that we had talked about. So we actually have contracted with MET for all of these plans now. So we'll start with dental insurance. And again, most of these plans have a network that gets us discounts, just like Blue Cross Blue Shield. And when you go to the network, you're going to save significant dollars in the area of 30 to 40% over what the dentists usually charge. So again, this is going to make your benefit go further. It's obviously going to save you for out-of-pocket expenses, and it pre-screens some dentists so that you know that you're going to some people that have sort of been vetted and validated and are in good standing with their training, etc. There's 2 options. One is the enhanced option. The biggest difference there is that it includes orthodontia coverage if you have children that might be needing orthodontia. Other than that, the programs look relatively similar, and you can see that there is a somewhat of a better benefit in network on the enhanced versus the classic plan. So again, as you get into basic services like fillings and extractions, you can see it pays 90% versus 80%. And for things like bridges and dentures, which are major restorative, they pay 60 versus 50%. And then, as we said, the orthodontia. Other than that, very similar in the deductible that would apply to Class B and C services. 3 times per family. Each person has a $1,000 annual benefit. Again, every person in your family has that $1,000 annual benefit. And then, in addition to that, if you're on the enhanced plan, if you had children under age 19, would be eligible to have up to $1,000 in orthodontia treatment reimbursed per lifetime. So per child has $1,000. Again, that doesn't cover adult ortho, but it does cover children up to 19. So again, look at this. You can see the cost differential between the enhanced and the classic plan. And any questions, again, reach out to us and we can talk you through that. Vision coverage, very inexpensive plan, and again through MetLife with in-network coverage. There is a large network of providers that you could actually visit. Going in network is definitely going to be the best way to get the benefit out, to get the most out of this benefit. So when you look at going out of network, I'll just draw your eyes to, from an eye exam standpoint, you pay $10 and then everything's taken care of in network. You have up to $45 that you'll be reimbursed out of network. If you get glasses, you can see that you would have coverage for up to $120, and then you get some discounts after that. You would only get a $55 reimbursement for frames going out of network. So again, differences here, and keep in mind that the eye care professionals are also giving discounts, so that $120 is going to go a lot further versus the $55 that they're going to give you without any discounts on the plan. So if you do look to the vision care plan, definitely make sure that some of the providers that are in network are ones that you can use or are using currently, just to make sure that that's going to be the best benefit for you. There's a number of voluntary benefits that were added this year. And again, these are things that we want to make sure people understand they have an opportunity to participate in. And this is also available for people that don't just work 30 hours or more a week, but 20 hours or more a week. So a little bit lower threshold here to qualify. There's a voluntary term life and AD&D benefit. There's disability benefit, which is a great add that we want to make sure people are aware of. And then there's accident, critical illness, and hospital indemnity benefits, which can be a great supplement to some of the benefit plans for medical, specifically if you're on the high deductible health plans. The voluntary term and AD&D benefit can be great if you just haven't had the opportunity to get life insurance in the past, and you have either young children, or you have a mortgage, or you have upcoming tuition and you're the primary breadwinner. Just things that you want to make sure that that your life and your earning potential is insured in the event that you're not around to fulfill those obligations. So again, you can buy $10,000 increments of group term life for up to 5 times your annual earnings, or a max of $500,000. And if you do so, you can purchase it on your spouse and or your children. So you do have to participate in order to buy it on your dependents. And keep in mind that buying at the work site is probably one of the most cost-effective ways to buy group term life. So if you look at the rates on these and compare these to some of the other offers you might get through a credit union or AAA or some other areas, I think you'll be pretty impressed. I will counsel you that as you get to age 40 or 45 or 50, you can see that these costs do start to go up. So if you're at those ages or coming up upon that age and you still have good sized mortgage, again, children that are going to go to college that you want to make sure there's money to provide for that, you might want to reach out to us also, because we can help you with a group an individual life insurance policy that might be, say, a 10-year flat term. And sometimes that can be a better option. But look at this, and if you if you have any questions, certainly reach out. I'm happy to help you make the right decisions in this area. Short-term disability is something that very few companies offer, unfortunately. But if you think about it, your salary is one of the most important things that you can probably insure. So this is to give you income protection if you're sick or unable to work, to help with all of life's everyday expenses. So it will replace 40% of your gross monthly salary, and it's going to come to you because you're paying for it. It's going to come on a tax-free basis that probably gets closer to 50 or 60% of your gross gross salary, or I should say of your take-home pay right now. The benefit is available to you, for a 26-week period of disability, which is great. So you can see the rates here. This is a very cost-effective, a very affordable way to insure your salary. And definitely consider this if you don't have any outside disability policies at this time. The accident insurance is one of those programs that can help supplement, especially people in a high deductible health plan. The quickest way to go through your deductible is to have an accident where maybe you had an ambulance ride, or you had to go to an ER, or you you're even hospital admitted. And this plan actually helps you in those with lump sum payments, which aren't offset by any of the other insurance. So they simply go to help your pocketbook in a time when you might have some pretty good expenses coming your way. So you can see that there's two options. There's a high and a low plan, and there's cost differences between the two. It covers a number of events. It shows over 150 separate coverage items that you could actually receive compensation for. So there's a lot more information available on this if you're interested. Just reach out to us, but this might be a great ad for people, especially if you're in a high deductible health plan. Group critical illness, a lot of people see different carriers that have a cancer plan or a critical illness plan. So a critical illness plan is a little broader than just a cancer plan. It covers episodes of heart disease or situations, as well as stroke, cancer, and Alzheimer's disease. So this is a wide-ranging coverage, and again, this can give you specific payments based on being diagnosed with any of those situations. So you can see that there's age bands, and for the rates, we can help you figure out what the actual cost per paycheck would be for you. But again, if this is of interest to you, reach out to us. This could be a great ad for people, especially in a high deductible plan where one of these types of diagnoses can come out of nowhere, can be pretty costly, and this coverage might be able to help you during that time. Hospital indemnity is also one that, based on if you're on a high deductible health plan, this reimburses you to offset the cost that you're having if you go into the hospital. So again, if you were admitted, this would pay you $500 or $1,000 depending on the plan that you had actually chosen. If you had to go to intensive care, similarly, it could pay you for that. And then you have a confinement benefit, which can pay, for up to 15 days in the hospital. It would reimburse you $100 or $65 for intensive care to offset those costs. So again, you could choose the high or the low plan. You can see the pricing here, which is a pretty affordable way. Certainly, I'd love to see people put money into a health savings account first and then maybe look at these. But some people prefer to insure things rather than put money into an account for that possible situation. All of the benefits can be enrolled on the self-service portal. So this is available to you, relatively new. This system is called Prism, and you can see the information here on how you could access the system and enroll. If you've never done it for the first time, you can do so with just your Social Security number that only you are going to see and log in, and then you'll get a password and you can register to log on. The group at OELS can help you go through this for the first time, or even be on site to help you do that if you have any questions on this. But this might be an option if you want to do self-service rather than either call in or have someone give you some paper forms to fill out. Again, we're here to help. This presentation will be available to you. This recording will be up and available to you. So don't hesitate to reach out to us with any questions, and you can see the phone number or email below. There were a couple of benefits that launched last year, and one was New York State paid family leave. So that in January of 2018 for New York State employees was launched. You can see for three main areas, it allowed you to take time off, and you could finally be compensated for it if you didn't have paid time off through your employer. So you can see that there's either family bonding. It could be to take care of a family member who's ill, or to help if a family member had to be deployed for active duty. So those three broad areas were available. The cost last year, I'll show you on this page next, you can see was a little bit cheaper than this year. As the table in the lower right shows, we could pay up to $85.56 last year. This year in 2019, we could pay up to $107.97. It's a percentage of your weekly pay, and you can see that is governed by New York State. We all pay into it, and it is based on the average annual wages in New York State, as well as the benefit plan on the top left. which from 2018, where it allowed us to take up to 8 weeks this year at 50% reimbursement up to $600 and almost $53 a week. Now we can take 2 more weeks up to 10 weeks and a 55% benefit replacement, or 5% more than 2018. And that would be up to $746.41 per week. So again, this is a great benefit, but we all do pay for it. The state doesn't pay any of it. Our employers don't pay for this. This is something that comes out of all employees' pay for New York State. Any questions on this? Certainly don't hesitate to reach out. And again, thank you for your time. Hope you find this recording useful.